All right. Thank you for being with me this evening. I've been looking forward to this topic. I'm going to be talking this evening about sciatica or sciatic pain. It's something I've been asked to talk about more and more. It's a problem that certainly appears to be happening more and more in our community. If you have any questions, do please go ahead and pop them in the chat. You should be able to see where that is. We are recording this. There are many people that I know are working and will want to be seeing this later. So this will be posted on YouTube within a couple of days. Okay, let's dive straight in. We all live here in beautiful Singapore, but we have, without doubt, in this modern city, created a very, very unnatural life, and one to which we're not genetically suited. We're all sitting too much, we're not moving enough, and we're all developing poor postures. And this is causing a deterioration in the quality of our bodies and especially our spines. The result is widespread pain. And to an extent that pretty much everybody has got pain. I know I do. I'm just a normal person, just like the rest of you. It's a fact that 30% of all adults will have back pain in any given year. And over a lifetime, 80% will have serious back pain at some stage. The chances of a given person from suffering severe pain at some stage in their life is pretty much 100%, right? So if you're suffering from pain and you suspect it may be sciatica, you are in the right place. Pain, to me, means pay attention inside now. Pain is what we perceive. It's something that the body is giving us to bring something to our attention, right? The pain is the body's way of being smart. It's like the red light on the dashboard. If it comes on, you shouldn't be driving your car because something is wrong. The pain is the body's way of telling us that something is wrong. All right. So after today, I want you to start looking at pain in a different way. Have a new respect for it, because to me, pain's a good thing. It's just telling me to make a change. I know that you think you don't want pain, but really it's an integral part of life. And most of us will have some kind of pain every single day. So we're talking about sciatic pain today. Sciatic pain, it's if you are one of the unfortunate ones that does suffer from sciatic pain or will do in the future, it is one of the worst pains you're likely to experience in your life. What is it? Well, it's more of a set of symptoms rather than a condition. There is a condition, an underlying condition, but the sciatic pain is the pain that you're feeling. That is what's on the surface. What we really want to address is what's underneath, which really is the problem. Okay. We know that sciatic pain can be very serious. It's got the potential to severely impact the quality of our lives. And it affects everybody, both athletes and those of us who are less active. The sciatic nerve, you can see there, it's that yellow line starting at the top, going all the way down. It's the longest nerve in your body, and even a tiny amount of pressure on it can result in tremendous amounts of pain. Typically, pain or numbness or tingling starts in the low back or the buttocks and extends through the upper leg down to the lower extremities on one side of the body. And wow, can it hurt? Also, if you do not address the underlying cause of the problem, then it becomes chronic. And chronic pain is something that's very hard to deal with because it gets wired into the body, right? The last thing that we want is chronic pain. Sciatica typically comes and goes, and you hear people talking of sciatic attacks. And that's why when it goes, it is likely to come back. So we really want to look underneath, and first thing we want to do is get the pain to go away, but then we need to go underneath the pain and look at the function, repair or improve the function that is out of whack, so that the body can then strengthen, and we can put this sciatic incident behind us. When people get this pain, it seems so serious at the time that people really do think that it's so serious that it can only be healed by a surgeon or with injections or drugs. Well, I'm here to tell you tonight that although nearly everybody will suffer from back pain at some stage of their life, sciatic problems very often go away. And that's what we're going to make sure. Tonight, I want to give you the best possible chance of reducing the pain and improving the function of the body. So, as I said before, we put it behind us. This nerve, the sciatic nerve, can be irritated. It can be compressed, pinched, pulled, twisted, all these things. And usually it's caused by a disc problem or arthritis in the low back. Perhaps bone spurs that are growing in the low back are putting some pressure on the nerve. It can be caused by inflammation, which will increase pressure in the area. Muscle spasms, we'll talk about that as we go through this. And loss of space. The nerves that come out that low back, they have to pass through little gaps. And if those gaps get too small, it can pinch the nerves. When we look at this sciatic nerve at the top, the correct word for it is actually sciatic neuropathy. And opathy means there is a disease process, and neuro means nerve. So basically, there's a disease process affecting the sciatic nerve. And you can see from this illustration that it comes out at the top at various levels. These levels, they come together. These are nerve roots where it comes out of the low back, out of the spine, and they all come together to form the sciatic nerve, which is a big old bundle of nerves, and it's the second biggest nerve in the body after the spinal cord. It can be about 2 centimeters thick, so it is quite thick. You see how it crosses the buttocks and then travels down the back of the leg, where it then splits into two. It splits into two behind the knee, and then it goes down the back. I think you can see that. This nerve can be affected by pressure, ergonomic stress, so sitting badly or lying badly, spinal misalignment, poor posture, degenerative changes, and very often when people suffer this type of pain, they don't know how it's happened. It's sort of come on and quite gradually, or maybe something quite insidious, like bending down to tie your shoelaces. That could be the cause, but actually the cause has probably been something that's been degenerating or something that's changing over a period of time, and then tying the shoelaces was sort of the straw that broke the camel's back, if you like. In this illustration we're looking at now, we see that the nerve roots, you can see them between L4 and S3, they all come together to form the sciatic nerve. And you see that they do come out at various levels. Well, L4 and L5, they are the most common level of irritation of the sciatic nerve, right? These are the bottom two movable segments of the spine, and between these segments are discs. And problems between L4 and L5 and L5 and S1 are the most common causes of the sciatica. S1 to S3, that's where the nerve roots come out of the sacrum, and the sacrum is sort of a big block of bone. There's no movement in there, so there is less likely to be dysfunction. Now you see these nerve roots coming together, and you see their relationship with the piriformis muscle. Now that's a muscle that's deep in the buttocks. Sometimes the sciatic nerve passes over the top of this muscle, but sometimes it passes right through the middle. So you can see that if there's problems or tightness with the piriformis muscle, you can see how it can affect the sciatic nerve. So today we're going to be addressing problems with the sciatic nerve involving discs, etc. But also we're going to be talking about muscle tightness and muscle problems that are causing something called piriformis syndrome, which again can cause these pains that go all the way down the leg. So how would you know if you have sciatica? People ask me all the time, they say, oh, I've got sciatic pain, but actually they don't. Let's just talk about how you would identify whether you've got sciatica. Number one, it is affecting only one side of your body only. It is associated with pain or numbness deep within one buttock, not always, but that is quite a normal presentation. You may or may not have low back pain. You can certainly have dysfunction in the low back, which is affecting the discs of the low back, which is not causing pain in the low back, right? Pain in the low back might turn up later. You may just have pressure on the sciatic nerve. It may be associated with tingling or pins and needles, we call them paresthesias, or even electric shocks, sort of zingers that might go down the back of the leg. The pain might be sharp. It might be, you might feel prickling or burning or tingling rather than a dull ache. You may get weakness because obviously the nerve that's going down the leg is being compressed. So you might get some weakness in that affected leg. And it actually may give way sometimes. So if you're standing up and you're not ready, then you might just get a little bit of a situation where your leg is collapsing a bit on you. The pain would usually be worse when sitting or standing, but when you take a weight off your body and you're lying down, it's alleviated. That would be a common presentation. The symptoms tend to go definitely below the knee, and very often they'll continue all the way into the big toe. And it may also be giving you an antalgic lean. What does that mean? It means a lean of your body that's being caused by the pain. So what you see here is quite a common and typical presentation of somebody who's got a disc problem in the low back. So you may or may not have searing pain, but you may be leaning to the side like this. Again, this would be a common presentation with a disc problem in the low back. So what are the common factors, risk factors? It tends not to affect the very young or the very old. So very often people in the prime of their lives, in their 30s, 40s, maybe 50s, some can go into the 60s, but very often people in the 30s and 40s and early 50s. So why is that? Well, basically, we're doing a lot with our lives. The degeneration that tends to stiffen us hasn't got that bad yet. So the movement can actually put quite adverse pressure on discs and cause a failure in the disc, which we'll look at in a moment. Unfortunately, we have a sedentary lifestyle nowadays. Sitting all day really is a problem. Our spines are functional things. The discs that we have in our spines, they need blood, they need nutrition, they need oxygen, and it's movement that provides us with that nutrition and that blood supply. Obviously, something like obesity, having way too much weight, that's going to put a lot of pressure on the discs, and diabetes is also a risk factor. What else can we look at? Well, we could talk about sports injuries. People, doing crazy. If you're sitting all week and there's not a lot of movement, and then you're a weekend warrior, and you go out and you swing your big Bertha if you've got on the golf course, or perhaps you're playing squash or tennis or anything like that, or any slips and falls, that can put a lot of force through these discs that are not healthy because of our sedentary lifestyle. If we look inside the lower spine, this is an MRI from one of my clinics. I think you can see my cursor there. If we look at these, so these are the bones, these square blocks, and between them are the discs. You can see that? So this disc here is quite light. So it tells me that it's got good fluid pressure and it's a healthy disc. When we move down, so this is a healthy disc, this is quite a healthy disc. Now, when we get down here, this disc is darker on the MRI. And so what's happening is that the disc is less, has less fluid. It's drying out a little bit, desiccating, they say. And because of that, the structure above is now squishing it. And we're seeing now that we're starting to get a bulging disc. Again, here we have a dark disc that's drying out, bulging disc. And then when we get down to the bottom, we've got a disc that looks like it's starting to herniate or prolapse. So now the disc is actually failing. It's suffering from some structural failure, and it may now start to be really impinging on the nerves. Now, this is probably more likely not something that's just happened like that. It's something that's been happening slowly and gradually over time, and that this really is a focus of what I do with our chiropractic care. When I take an MRI nowadays, many people, a huge proportion of people who are totally without symptoms are showing signs of desiccation of the discs and bulging discs. Now, if we can get onto these things early and restore function, range of motion, and get movement, daily motion into these discs, we can bring them back to health. But if we leave it too long, inevitably, because the weight of our bodies on this bottom disc, and L5-S1 is the most common disc that will fail, then this is almost an inevitability, and it's happening more and more. So, I really want to get home to you that almost everybody on the call today will have some deterioration in the quality of the discs. And, with our chiropractic adjustments, we're restoring function, but really we've got to support that with better alignment. So that means good ergonomics, how we're sitting, how we're lying, and then during the day we need more movements that's going to supply. These discs at the bottom there, you see, they do not have a direct blood supply. They literally get their blood, which includes the oxygen, the chemicals of repair, all the nutrients of life. It comes from the pumping action that is caused by motion. Okay, we simply need more motion in our lives. Unfortunately, our life looks a bit like this, and unfortunately, there's way too much pressure being applied to our lower discs, not enough movement. As we sit like this all day, we're losing the core muscles, which go into a state of atrophy. So they're losing their strength, they're losing their coordination. And if we're sitting all day like this, not moving enough, then this literally can be thought of as a time bomb. One fine day, or maybe not so fine day, the disc will fail. And sciatica is one of the things that's highly likely to happen. So let's think about how we might treat sciatica. We see, just to remind ourselves, that the problem often is at the top, where these nerve roots that you see here exit the spine, or perhaps it's where the piriformis is causing a problem here. Well, the good news is that with proper care and a little time and consistency, you can definitely get your life back. So I know if you've got sciatica, your life is compromised, but normally we can get our lives back. And sciatica often resolves. And very, very often, and in fact, normally, then we can recover with conservative therapy. And that means without resorting to dangerous drugs, medications, surgery. Okay? Now, remember, the sciatica comes in attacks. If you've had one in the past, and you may have one coming again in the future. And it may be when you're traveling, it may be when it can happen really at the most inconvenient times. Lots of my clients tell me that they get things like sciatic attacks if they've been traveling and then they're lifting their big heavy case off the carousel in the airport. You know, that's a typical one, or it literally could happen almost any time. We've really got to address the underlying cause. So what I'm going to do now is I'm going to go through some do's and some don'ts. It is nearly always the result of a degenerative condition. So that means things have been deteriorating over time. So we've got to do everything we can to reverse this process. We have to improve alignment, which means posture, and that means our alignment all day, doing whatever we do. If we're running, we want to run with good posture. If we're sitting all day, we want to do with good posture, good ergonomics. If we are lying, we want to have a good mattress that's supporting our spine. We don't want to be sagging. Alignment is vital. If we've got any kind of disease process in the body, there will be some inflammation. So if there is sciatic neuropathy, there will be inflammation, more likely in the low back or in that lower gluteal region. So we want to reduce the swelling with cold. We do not want to be using heat on inflammation. We may use a bit of heat later on tight muscles, but initially we want to get down the inflammation. So the application of cold would be the good thing. So icing the low back or the glute may well help. We saw in the MRI, we saw those discs that have gone dark, okay? They're drying out, thinning due to poor movement. So therefore, the therapy that we are going to utilize must be movement-based care, okay? This is vital. We've got to restore normal movements. And how do we do that? Well, controlled exercise, dynamic stretching, chiropractic adjustment. The chiropractic adjustment is not stretching, it tends to be global. We stretch the low back, we tend to stretch the whole of the low back. The chiropractic adjustment, one of the reasons why it's so effective is that we are isolating the affected bad joints, and we are giving them a spinal manipulative therapy, if you like. We are focusing our manipulation right on the affected joints, okay? So that's very, very important. As far as movement is concerned, we really want to be moving more every day. So as I said, if you're sitting all day, we want to be standing up at least twice an hour, moving around for a couple of minutes, go back to our chair, sit down, good posture. And then we need to have movement during the week. So I'm talking about walking, perhaps movement in the gym. It's recommended that you want, over the period of the week, at least 150 minutes of moderate exercise. Now, moderate, what do I mean by that? Yes, gentle running would be moderate exercise, but also walking, right? So all is not lost if you're not a if you're not a gym junkie, or you don't have time to go out running or whatever. Brisk walking for half an hour a day, 5 days a week, will get you to that. I myself, I like to get some movement in my body every single day. I know that's not always important, but 5 times a week, get out walking fairly briskly. That's going to go a long way to getting you over the line 150 minutes a week. All right. So functional exercise, we definitely want to be improving our core strength. So we'll talk about that. I do a lot of planks. It's one of the things that I do. I do a lot of lifting, and in my job, lifting clients and everything, I'm strengthening my back all the time. But in a world where we're all getting muscular atrophy due to lack of movement and lack of exercise, we really have got to do some focused exercise. So we'll come to that. Think about your daily routine. Are you getting enough exercise? Where can you bring exercise in? Can you literally just jump off the MRT one stop early on the way home and just and get 20 minutes extra walking there? Always do it. When you do anything, try and engage the abs. Lift your sternum to improve your posture. Pull that head back. Create space in your upper thorax. engage your abs to take the pressure off your low back. That's something that I try and teach everybody. If you can get some exercise back into your life, you know it's going to pay huge dividends. You know, it's something that should be fairly intuitive. It might be hard work, but what we want to be doing is creating good habits. Literally down the road, what you do today, the changes that you bring into your life today are going to reap enormous benefits. Please don't wait for a small problem to become a big problem. All right? So why is chiropractic so effective? Well, and it's highly effective. The statistics certainly do not lie. And we know that in our clinic, we get over 90% of our sciatic patients find enormous relief, very often 100% relief. A recent study that was done in America showed that generally chiropractic is effective with 89% of clients, and they respond extremely well under focused chiropractic care. Okay, and this is why chiropractic more and more is becoming part of functional medicine. Our bodies are functional things inside and out, and we literally, when we're improving the function of the body, we have to have movement-based care, and then the most focused movement-based care is chiropractic. Okay, always remember that this is a structural problem which almost certainly needs a structural solution. Chiropractic is safe, it restores function, it restores range of motion, it improves and restores the flow of blood and nutrition and oxygen to those tissues. And very importantly, it creates space for those nerves. Very often, it's something to do with a deterioration of the spine that's putting pressure on that nerve root. It might be a deteriorating disc, it might be a bone spur, it might be a vertebra that's rotated or tilting to one side. Either way, it's either directly on the nerve or it's causing some inflammation. It's almost certainly been recognized by the body as a lesion, and any lesion in the body, especially the spine, is certainly going to cause inflammation. Inflammation increases pressure. Inflammation also brings pain, and it creates fibrosis. Fibrosis, what does that mean? Fibrosis is scar tissue. So now we've got scar tissue building up around this nerve root and the affected joint. And what does that mean? Well, you're likely to end up with adhesions. So that means where the nerve exits the spine, it literally gets stuck to the structure. So we need some specific strategy to reduce the inflammation and then unstick the joint, unstick this nerve that's getting all that has adhesion. So we're going to talk about that in just one moment. Everything I'm talking about, and when you go into our chiropractic clinic and our doctors talk to you about what's happening and the symptoms and what's required so you can fully recover, we're not just talking a band-aid here, we're talking recovery, then everything should make sense when it's explained to you when you see it on the X-ray, all right, or the MRI. Everything we do is allowing, it's facilitating healing in the body. Very, very important. Luckily, our body is designed to heal. We all have the same DNA that made us. It's perfect. And all we've got to do is restore what the body needs, which is no interference. Improve the function, reduce or remove the interference, the body will heal. Right? So now let's move on to exercises. Exercises that we can do on a daily basis to prevent, manage, or relieve sciatica. And there's many. I'm going to go through some that I know work, some that we teach our clients. If anybody would like any videos of these specific exercises, then please let us know. We can send you copies of little videos that demonstrate all these very, very, very important exercises, very important to people who've got sciatic neuropathy. right? So the first one I like to teach is simple, simple, simple. Lie on your back. First pull one knee towards your chest, then the other. Hold it for 20 seconds. You're opening the low back, right? Perhaps you perhaps leave it for 20 seconds, relax, perhaps do it again 4 or 5 times. You can pull a little bit tighter. And then if you can tolerate, you could even do some rocking on your back. Okay. Now, while you're on your back, you might want to do some lower trunk rotations of the core. So you can see the position of the legs there. While you're lying on your back there, legs bent, you just roll your knees to the side, hold it for 20 seconds, and then return to the start, and then over to the other side. Hold for 20 seconds. You might even go into a little bit of rhythm. We're getting movement in the discs, but remember, these exercises will only work if you do them consistently. It's like anything we do in the gym. We will almost guarantee changes if you do it consistently, right? All these exercises, they work better in conjunction with chiropractic chiropractic adjustments, which of course are restoring the range of motion in the affected joints, right? So, we're still in that position, lying on the floor. Here we go. We're now going to flex your knee to 90 degrees. You're gonna hold it with the opposite hand, and you're gonna roll over to the side. So you're gonna gently lower your knee towards the floor, but while keeping your shoulders flat on the floor. All right. You'll feel a nice rotation in the back. You can pull it a little bit tighter. You can direct the stretch into that low back. Remember, it's the bottom 2 discs we're trying to affect. So you can sort of direct that stretch right into that low back. Also, this will be gently stretching the piriformis muscle that we spoke about before as well. You're doing this on both sides, always listening to your body. Any pain, any serious pain, stop. Listen to your body, all right? If you're getting any real pain, then perhaps you want to report back to us and we can advise accordingly. Another great exercise that I like to teach my clients is the cat-camel stretch, or yoga pose if you like, and just basically on all fours like that. Hands and knees hands and knees on the floor, and then your shoulders and your pelvis right above those. So you're in that starting position. And then you're going to alternate between rounding your back, so pushing up, rounding it like a camel, or dropping it down and arching your back like a cat. Okay? Now, this is something that you can do rhythmically. You can push up, hold it for a few seconds, and then you can drop it down, and you can hold a few seconds. This up and down, it's really stretching the spine, and it's pumping the discs. I always like to think about pumping discs because that's creating this pumping action, which is bringing that life-giving fluid into the discs, all right? We are always trying to regenerate discs which have deteriorated. They have degenerated. They have become deconditioned. So we are trying to recondition them with stretching and movement. Okay. The next one I'm talking about, you can go straight into it from this position, is child's pose. Very, very simple. This feels very, very soothing if you've got tightness in the back, tightness in that piriformis muscle, pain down the legs. This should help you. Child's pose. You can push those hands further and further away, pull your body further and further away, and you'll get this nice, gentle stretch through down the spine and into the low back, right? Again, start to think about doing these things on a daily basis if you're suffering. Show the body how you want it to change. I mentioned muscles. Muscles do deteriorate. We must get our core strength back. So I've put in 3 levels of planks. You can start initially by just you pulling your elbows, your forearms, either on the chair or on the desk. Get your body nice and straight, and you contract your core muscles, those core muscles in your abdominal region.
Once you can do that on the chair, then you can move down to the floor. Again, this creates a bit more strain on the spine, so it's doing you more good. Every time you do this, you can hold it for maybe 10 seconds and then relax, and then do it for another 10 seconds. You can do this perhaps 2 or 3 times, right? If you're becoming an expert and this is becoming too easy, then this is the one I favor myself. I drop down to the floor, taking my weight on my forearms again, and then I myself lift one leg up and drop it. One leg up, drop it. Maybe hold it in the raise position for a few seconds, and then slowly drop it. Not only is this creating good contraction of the muscles, but it's recruiting the neurology, the reflexes, because we're doing some balancing here as well. So it's very, very good for the reflexes in the low back. Right? Now, in the low back, there are some extension exercises which I want you to try. You can see here, lying on the floor, again on our forearms, if you gently just ease your head up and lift your chest region, then you're starting to get this extension of the low back. This will have the effect of opening the discs at the front, and it could well help you enormously. It might even suck, if you've got any bulging of the disc, it may help suck that disc back into its proper place. So you can do that, lifting up, holding for some seconds, then dropping down, do it in a very slow rhythm. You want to hold in the upper position, maybe about 10 seconds, and then slowly drop. If that's becoming easy, you can go a bit further, hands on the floor, just pushing yourself up further, a little bit more extension. Listen to your back. If it's causing pain in the low back, then back off a little, okay? We don't want to be causing acute pain. We are probably causing a little bit of discomfort. I will say that is okay, but real pain, then that's the body telling you to stop, okay? You can report that back to us. And another one which my clients like enormously, and when I've had a bad back in the past, I learned to do this myself. And it's a passive low back stretch. Just you're lying on the back, maybe on a yoga mat. Your legs are going to be lifted. Your feet are lifted. Your legs are bent at 90 degrees. And just relax and let your low back flatten onto that floor. And you should find that relieving. It's basically it's relaxing the back. And again, it's just opening the joints at the bottom. Now, if that's working, then what you might want to do is put a cushion on the chair, and so that part of your leg starts to actually take your weight. So you could lift the bottom of your legs up by maybe 4 inches with cushions, and then let the weight go on, and you might find your body weight is pulling down, and you might find that is opening that low back nicely. Right? Now that can give good relief. And if it is giving you good relief, feel free to repeat this as often as you want. And this could really be a few times a day, okay? We spend our lives sitting, so we need to look after our sitting posture. So a couple of things. First of all, we need to learn what is good posture. So I'm going to show you right here. First of all, lift your sternum, your breastbone, high as it'll go. You'll notice your head came back on your shoulders. Open your shoulders, engage your abs. You should now have a nice curve in your low back, and you're sitting nice and tall, right? So in that position, I then want you to engage all the muscles of your abs. So those core muscles, engage them, and you hold those tight for 30 seconds. Engage those muscles, hold them tight for 30 seconds. After 30 seconds, you may then release. But then do it again. And you want to do this a few times. Engage those muscles. So we're getting our body used to engaging the core, sitting in good posture. If you do this often enough, this will become you. You're teaching your body a new habit. And believe me, it's a really good habit, especially if you spend your life sitting at a computer. Right? We're all sitting too much. We literally have got to learn better habits. Right, while we're talking about sitting, I think a great thing for people who've got disc problems, and 90% of sciatica comes from disc problems, is the use of an exercise ball. When you get home from work or whenever you want really, pull that exercise ball out, sit on it, put yourself in good posture, and just put some gentle movement. If you have pain, listen to your body, try and find some movement where there is no pain, but hopefully you are in a situation whereby you can roll the ball from side to side, forward to back, getting some movement in there. You can just gently bounce if your body allows you, gently move, do some rotations. This is helping with core strength. It's improving your balance. It's very hard not to move when you're on a ball, and it's very hard not to balance, okay? You sort of naturally do it. All this movement and all this balancing is helping you recondition the balancing muscles in your low back. Very, very, very important. It's a simple thing. Almost everybody tells me that they use a ball. Will tell me that it helps improve their strength, and basically eventually help your body recover its strength and resilience, because we do not want any more of those sciatic attacks. So we've got to recondition our back and build our resilience. Right? A ball is excellent at this. Now, I mentioned something called dural adhesions, and remember, this is where the nerves get stuck in the nerve roots. So where the spine, where you've got a hole and you've got the spinal cord that comes down, you've got these nerve roots that come out, and they come out these little holes. And if there's inflammation, we can get something called dural adhesions, where the nerve literally becomes stuck. So we want to learn how to pull the nerve through the hole so we can free it up. And we do this by something called spinal flossing. So these next few exercises I'm showing you is how we do spinal flossing. So what you can see here is a lady lying on a table. She's got her leg, her hip flexed, and her foot is in the air. And what she's then going to do there is she's going to pump her ankles. She's going to flex her ankle, and then so dorsiflexion is when you lift your toes up, and then plantar flexion is when you straighten your ankle, so you point your toes. So you're literally, your feet are up and you're dorsiflexing, plantar flexing, dorsal flexing, plantar flexing. And what this is doing, this is tightening the nerve and then relaxing it, tightening the nerve and then relaxing it. And it's having the effect of pulling it through the holes in the spine. And we continue to do that, perhaps for 20 seconds, maybe do it 2 or 3 times a day. This will hopefully gradually free up these nerves as they exit the spine. Once you're doing this, you can actually create more of a stretch on that spinal cord by lifting your head, as you see here. So again, you're doing the same, just dorsiflexing, plantar flexing, dorsiflexing, plantar flexing the ankle, and this is pulling the nerve through the holes of the spine, and we're increasing the effect by lifting our head. Okay? So now I'm going to show you how to do this. Now this is called flossing, and just like flossing your teeth, we're pulling something through the cavity, right? So I'm now going to show you how to do some flossing in the sitting position. So again, we're sitting. So here, what you see here is you see somebody that's sitting. She lifts one leg, and again, she's going to straighten the knee and bring the ankle up into dorsiflexion. And she's going to go slightly out to the side, so eversion. And then she's got, at the same time, she's going to look up to the ceiling. And then she's going to drop it down and then look up. So as she brings the leg up and dorsiflexes the ankle, she's going to look up. And then as she plantar flexes the ankle, she's going to look down. And she's going to do this up and down and up and down. And gradually, what this is going to do, again, it's going to be pulling
this nerve in and out of the whole of the side of the spine. As I said, if anybody needs any demonstration of this, we've got some demos, some little videos that we can send you. All right, just let us know. We can do that after this, after you've seen this. Now, I mentioned, of course, the piriformis, and there again you see the sciatic nerve here and where it leaves. So here it's leaving the spine between L4, L5, and L5 and S1. S1 is the sacrum. Here we see it leaving the sacrum, and then it comes together and forms the sciatic nerve. And here we're seeing it going under the piriformis. So we need to learn how to get any contraction of that piriformis. We need to get it to release. So I'm going to show you some piriformis stretches right here and now. All right. So piriformis stretch. So what you see here is the lady is lying on her back. Her right leg is bent and her left leg is crossed over the other leg, placing the ankle on the opposite thigh, just above the knee. Okay. She's then going to grasp the uncrossed leg under the thigh, and she's then going to gently pull it towards herself. And she's going to hold that contraction for sort of 20 seconds or so. And then she's going to gently release, and then she's going to repeat this on the other side. And then she's going to repeat this whole process about 4 or 5 times. When you're doing this, you will feel a tightening right in the butt, right in that piriformis, deep in the gluteal muscles, right where we want that muscle to be stretched. All right. So this is a piriformis stretch, highly effective. Again, if you want to see the video, let us know. We can also do some myofascial release. Now, what is that? Well, if a muscle is in a state of contraction, if we can press something into it, it will actually prevent blood getting to the tissue and force it to release. So that's what we're going to do. So you can see in the illustration here, this lady in the illustration at the top is just lying on a tennis ball or something like that. She's putting it right on that deep gluteal muscle, that piriformis muscle. And then she's going to angle her body slightly towards it. And then she's going to sort of roll on that area. And it's going to press right in on that piriformis. It's going to affect the flow of blood to the muscle and help it release. On the bottom, you can see the lady is using a foam roller. And again, you place that right on that deep gluteal muscle, perhaps lean into a little bit, and then perhaps you can roll over it. Maybe you hold the pressure right on that muscle for a while and help it release. Again, on this one, you can see the lady is she's put that muscle, that tennis ball right where it's needed. Right, so this is piriformis myofascial release, and this is when you have piriformis syndrome. So the piriformis is in a state of contraction, squeezing that sciatic nerve, causing all those symptoms that we are talking about, going all the way down the leg. One of the things that we've absolutely got to make sure we're not doing is lifting badly. So whether it's at work, whether it's at home, we've got disc problems, we've got to avoid lifting badly. It really will exacerbate it. If you've got a disc that's bulging or prolapsing, herniating, I almost guarantee this is going to make things worse. So we have to stop doing that. So we need to employ good lifting posture if we must lift. The one on the left is a big no, 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 red cross there. And the one on the right is that's how you want to be doing it. So you want to bring the load to your body. You want to make sure your spine is nice and straight, almost in extension. And then you're going to lift with your legs, those big muscles of your legs, and not with your back muscles. Okay, so we've talked about chiropractic care, we've talked about exercise, we've talked about stretching, we've talked about piriformis syndrome, we've talked about how we can relieve muscle tension, tightness. All these, remember, this is a problem that is structural and functional. There simply must be a structural and a functional solution. Now, there are certain instances when things can get so bad that you should consider seeing an orthopedic surgeon. So let's just touch on that. Chiropractic is amazing. It is not for everybody, right? If somebody leaves it too late, then perhaps you need surgery. And I hope this is not you. Please, if you've got a problem, get onto it early. Don't let it deteriorate. But there are certain times. So let's just touch on that. Normally, you can alleviate the pain by certain positions. Okay? Now, if that is you, then that's a really good sign, right? Almost certainly we can improve your situation. But if the pain is always there, no matter what you do, any time of day, nothing relieves it at all. Even after you've tried less drastic, more conservative therapy, then it's looking highly likely that you might need surgery, right? Always remember, try to avoid surgery when possible. There is always risks. Risks of infection, risks of blood clots. There is failed surgery syndrome. Usually it's okay, but at any one time in my clinic, there's always people coming in that have got all kinds of sequelae from surgical solutions that have gone wrong or have not been, that don't last a lifetime. You can have surgery on one disc, and then because we never fix the dysfunction in the spine, then we then have a problem in the next one. And we can't just having surgery after surgery after surgery. You've got to fix the cause. There is another situation when surgery is is highly likely, and then there's a rare disorder called Claudia-Corda syndrome, and this can be a surgical emergency. It's when you have serious compression of the spinal nerve roots, and you would know when you've got that when you've got it's called saddle anesthesia. So basically, you've got numbness, your whole butt area. Imagine you're sitting on a saddle. That whole area that you're sitting on goes numb, and it's called saddle anesthesia. And so basically, your whole backside has gone numb. This is a sign of this Claudia-Corda syndrome, which can be very, very serious. And it can lead to things like urinary bowel problems. That could also be a sign. But if it's not dealt with quite urgently, then unfortunately it can lead to things like incontinence or even permanent paralysis of the leg. So if you have this numbness of the butt area, this saddle anesthesia, then this is a sign that you need to go and see an orthopedic surgeon. Right? If we look at this next MRI, then what you see here is that at the top here, the red arrow shows the spinal cord in the central canal. This is the central canal. Here's the vertebra. Here's the disc. The disc to the bottom are looking darker, so we know that they're less healthy. And then this bottom disc that the yellow arrow is pointing to, you can see that it's failed. Now this is a serious slip disc. It's pressing on the nerves in this region. And here you see it again here. This is highly likely that it needs surgical intervention. But having said that, you might as well try chiropractic first, because if we do a series of adjustments and it improves, well, we've helped many people with discs that look this bad. So all is not necessarily lost, but I've got to say this one is looking pretty bad. Okay, so I've gone through a lot of stuff there. So please, I'm looking at the chat opposite. If I've got one important message to you, it's please, if you've got problems, act early. Everything in life tends to be a process. And if you're getting pain, please
act smartly. The body is acting smartly by giving you the pain. It's how you react to that pain that I think is the important thing. So I'm just going to pop up my last slide, which is my QR code. If you take a snap of this, this will help anybody you know that's suffering from these conditions find their way into one of our clinics. You can see my email address there. If anybody wants to address me, I will answer. That I promise. Please share this with anybody that I can help with. Okay, I'm going to leave that up while I have a look at the chat. So, oh, there's a few good ones. Nice, nice, nice. So, Alan, sciatic nerve pain only travels downwards. Is there a way to tell if the pain is caused by sciatic? The sciatic pain, well, basically, if it's going all the way down the leg, then it's highly likely to be the sciatic nerve. If it's following the route of the sciatic nerve, so that's down the back of the leg. Now it might be not compressing the entire nerve. You may just feel it in your lower legs or in your big toe. Nevertheless, it's most likely to be compression of the nerve roots where they exit the lower spine, L4, L5, L5, S1. Failing that, it's likely to be the piriformis muscle. Okay. Can overweight cause a sciatic nerve pain? Yes, it can. More weight, more pressure on the discs, pushing them out. I'm afraid by carrying extra pounds, it's only going to create more gravitational force, which is likely to increase the problem of anything, whether it be poor posture, whether it be spinal irregularities, loss of alignment, failing discs. It's all exacerbated by carrying too much weight. Okay. Please keep your questions coming. Yes, keep them coming. Slip disc pain similar to sciatic nerve pain. Well, yes, a slip disc pain may or may not be causing sciatic nerve pain. If it's going down your legs, then it is sciatic nerve pain. You may or may not be experiencing the pain in the low back. Discs have a lot of nerves. They are highly innervated. So a failing disc might itself be giving you a lot of pain. The swelling in the joints, the swelling around the joint capsule of that joint in the low back, that might be giving you a lot of pain also. So yes, you may have pain in the low back, singularly. You may have pain going all the way down the leg, or just in the lower leg, singularly, or you may have both. It's all generally comes back to this a similar problem in the low back. Can the bad disc grow back or recover? Or artificial disc injections? Right. Okay. Good. These are really good questions. So we have something called limitations of matter. Yes, discs can improve. Once they have desiccated, they literally become scarred. They are never going to be perfect again. However, we can get a bad disc that's not moving very well, and we can get it moving much, much better. So functionally, it can be much better. We can improve the alignment. We can improve the blood flow, the supply of nutrition and oxygen, those chemicals of repair. We can improve all that. So they can definitely improve. So they can recover. All is not lost unless you've unless you've really left it too late and you've got a really severe problem, which might need surgical intervention. But remember, over 95% of people are helped in our clinics. Yeah, artificial disc injections. So yeah, so the surgeons, they do get to work. They've got a fairly uninvasive operation where they go in with small holes, so it's microsurgery, and they go in with lasers and they do something called a micro discectomy, and they will shave off some of the disc. Again, it's something that we want to try and avoid. They are not fixing the cause of the problem. They're fixing they might be fixing the immediate pressure on the nerve, but whatever caused that problem is not being fixed. So they're not looking
very far upstream. So again, but it can help in the short term. And yes, they do inject things into the disc, whether it be some kind of resin or even some kind of cement to stop it collapsing, the disc, the actual vertebra collapsing. So yes, they do have various solutions. So I'm not really an expert on it. I do see all sorts of things. They also use titanium and screws and to try and immobilize the spine. Again, this is, you know, this should really be last resort. Okay. Good. Somebody's going to get off at the MRT station early. I promise to try tomorrow. Right. Well done, ET. I applaud that. The trick is to make it a habit and do it almost daily. An operation requires to solve the pain for good? Not necessarily. You know, operation is last resort. Please go for something that's less invasive if you can. And in our clinics, generally we will know within a few weeks whether our treatment is going to work. So please talk to one of our doctors, use this QR code. That will help you find your way into our clinic cheaper. Favorite pose? My favorite pose. My favorite pose for sciatic pain. Basically, I've gone through a lot of poses. All of those work. You've got to find your favorite pose that works for you.
That was a comment on your slide, actually. Their favorite pose.
Oh, okay. So anyway, everybody has favorite poses. Everyone's different. We all have discs that are bulging in different areas. So different poses might have different effects for different people. So try them all and see what works for you. And again, we have many, many more. So again, when we see you on our clinics and you talk to perhaps our rehab specialist, then we will find one that works for you. How do I get hold of the exercise video? Then, okay, Mengyang, we are making note of it right now. Please ask what exercises you would like the videos for. What sort, Eileen, what sort of pain do one want to see orthopedic surgeon? Well, any catastrophic pain that won't go away, right? If it's bad pain that simply won't go away, no matter what you do, then probably you're heading towards an orthopedic surgeon. If you can alleviate the pain with certain movements, then it's highly likely that movement-based therapy, which is probably going to be chiropractic, plus rehab, plus stretching, plus strengthening. It's certainly going to be a program of care that's going to help you. If that fails, then yes, then you're going towards an orthopedic surgeon. Please feel free to email me with any more questions. And yes, we do have a recording of this webinar. It will be posted on YouTube within a couple of days. I think that's about it. Okay, if there's nothing else there, then please feel free to shout out now. If not, I'm gonna end this. I've enjoyed this presentation. We've been on about an hour now, so I am certainly getting ready for a cup of tea and my dinner. So I'd like to wish you all a very pleasant evening. Thank you for staying with me. There's quite a lot of you have been on. I'm very pleased. Hopefully, I've given you some good information there. And if you have any questions, then please go ahead and contact me. And I promise to come back to you. Okay, so thank you so much. Have a great evening ahead. I'm gonna finish now, and hope to see you soon in the clinics. Okay, bye now.